Tonight, Americans are preparing for a third dose of the COVID-19 vaccine.
This is no time to let our guard down. We just need to finish the job with science, with facts, and with confidence. And together, as the United States of America, we'll get this done.
The president says the general public will be able to get a third dose in a matter of weeks. Good evening, I'm Lisa Bell.
Hey, glad you're with us tonight. I'm Matt Austin. Today's announcement is based on new data regarding the Delta variant. The CDC found the Pfizer and Moderna vaccine lost effectiveness against the variant over time. Pfizer's efficacy fell from 76% to 42%, while Moderna's efficacy dropped from 86% to 76%. Data is still pending on the Johnson & Johnson vaccine. The Delta variant accounts for nearly 99% of all U.S. COVID-19 infections. Federal health officials are advising Americans to get their third dose 8 months after their second shot. Right now, boosters are already available to those who are immunocompromised. We know there are still a lot of questions about these third doses. News 6's Nikki Zizaza took some of those questions to a doctor. She joins us now from the newsroom.
Well, Matt, while federal health officials recommend to stick to one manufacturer when preparing to get a booster, health experts I spoke to say some studies show you will still have a strong immune response even if you mix and match vaccines.
It's an announcement the health community has been anticipating.
Just remember, as a simple rule, 8 months after your second shot, get a booster shot.
President Biden settling on a timetable for booster shots the week of September 20th.
We'll be able to get the booster shots at any one of approximately 80,000 vaccination locations nationwide.
Dr. Michael Lizardo with the University of Florida Health says the vaccine's protection against infection wanes over time, making it necessary to get a third shot.
Most of the decisions in terms of the intervals and how frequent and how many you get are based on the data.
But questions are swirling about whether you can mix and match your booster.
The thought is that if you get an mRNA vaccine, that's either Pfizer or Moderna as that second dose, it's probably, or that third dose, I should say, or second dose for those who got Johnson & Johnson, the benefit is probably greater. In other words, the mRNA vaccines have the strongest immune response of all the available vaccines that are available for COVID now.
Dr. Lizardo says data being monitored shows a mix and match approach can still provide a strong immune response.
There is some data that's come out and some studies that have shown in the UK in particular that showed that you can mix and match the different vaccines.
As for the population that opted for the Johnson & Johnson vaccine,
most people in the country got Pfizer or Moderna, far outnumbering those that got Johnson & Johnson. So the review of the data and the analysis is going to be focused on that'll have the biggest impact on the most number of people.
Federal health officials say nursing home residents, healthcare providers, and the elderly will be the first groups prioritized. Dr. Lizardo agrees.
And my real priority is the fact that we are looking at in the state of Florida, we still have 40% of the population that has not had a single dose, right? And then that is the population that continues to drive the pandemic.
Now, Dr. Lizardo says we can expect guidance for a booster for Johnson & Johnson in the coming days, but more importantly, he says the focus should be on vaccinating the unvaccinated population. In the newsroom, Nikki Zizaza, Getting Results, News 6.
Nikki, thank you.